Good evening, everyone. Welcome to Ageless Intimacy with
Dr.
me
Mia and
and
Joseph.
Joseph.
Hold on 1 second. What you talking about? Oh, it's not plugged
Somebody
up.
plugged up. Our bag. Hold on. Uh, Microphone check. What is this? Good evening, everybody. Welcome to Ageless Intimacy with Dr. Mia and Joseph. Hope all is well. All is well. Today, we come to you to talk to you about
Intimacy and communication. So, I'm Dr. Mia at Bella Wellness Center, where we offer gynecology to women and adolescents, as well as weight management, hormone pellet therapy, intimacy services, total wellness with supplements, and laser hair removal. Our goal at Bella is to help you live well, age well, and experience everlasting intimacy. So intimacy is a huge topic that we talk about at Bella Wellness Center, and a big conversation is how do we make sure we can maintain everlasting intimacy? And we know that a big part of that is not only living a life of total wellness, but also good communication with you and your partner. So we wanted to talk a little bit today about communication, because Joseph, what do they say? One of the most common reasons for divorce or breakups, would it be communication?
Yeah, it's having a wife. That's the most common reason for a breakup in the marriage is having a wife.
Yeah, I really hate those jokes when he does them, and I still don't think they're funny. But
So,
the main thing is lack of communication, because even when it's finances, with good communication, you can get through that. But if you can't really communicate effectively, then that's going to negatively affect your relationship.
absolutely. Absolutely. So, what are the common things you think people don't communicate about?
Well, for one, a lot of times people don't know how to communicate what they don't like with their partner. So, for example, and especially if it's something as sensitive as the topic of intimacy, it's really difficult for a lot of people to start that conversation, because it is definitely a level 5 kind of conversation, very complicated conversation, one that needs to be had, but it's not a very easy topic. So, I think one thing is intimacy. I think another thing is
So, are you saying, and again, we have to differentiate in intimacy because are you saying, um, um, physical intimacy? Because I know that's one thing that's hard to communicate. But are you saying because there's so many different ways of intimacy, but physical intimacy seems to be the most common one that is hard to difficult to communicate with the spouse, and it is whether or not what type of intimacy you want, or how you want it, or if something's wrong, or if you want it or not. So I think that that's the most common one. That's people say, well, that's a difficult conversation, but there are many other types of intimacy that's not
physical.
Communicated as well.
Like emotional intimacy.
Emotional intimacy, even recreational intimacy. There are things that your spouse may want to do that you don't like to do, or things that you want to do that your spouse may not like to do, or things you want to do that you're not even expressing. Let's say it's real simple. Like, let's say you like to go to amusement parks, but you don't like to ride roller coasters, you know, but your spouse wants to ride roller coasters all the time, but you hate it, but you love amusement parks. If you don't communicate that, and that's a form of intimacy. If you don't communicate that, then that could become an issue in the relationship. So,
yeah, communication on all levels. I think, like, we get so busy in the hustle and bustle. So even just taking the time to communicate, and even communicating, not even just difficult conversations, but good stuff. So taking the time to make sure that y'all are spending some time at the end of the day to talk about your day and what happened, and making sure that you are really practicing a lot of emotional intimacy, which definitely requires good communication. But emotional intimacy is when you can have those difficult conversations, or share your past with your spouse, or talk about things and how they affect you emotionally, talk about your feelings, how you feel. That is kind of level 5 communication, because you have to allow yourself to be vulnerable to have such conversations. But they are necessary conversations because it's a huge part of emotional intimacy, which really brings you so much closer. So that when it's time for physical intimacy, everything is already connected because that emotional intimacy is in check because you communicate.
Mm-hmm.
And even spiritual intimacy, like talking about the word of God and praying together and those sort of things, and making sure that, you're making your plans together, discussing your future desires, what you want, what you're working on. So communication, I think on every level is very important. Even just, how you greet each other when you walk into the room or you hadn't seen each other, you waking up for the first time. It's a certain way that you communicate, because communication is not just what you say, but it's also your actions, your body language, your tone, the words that you use. Communication is affected in so many different ways. And to me, one of the hardest parts of communication for everybody is the listening part. That's where, a lot of difficulty comes in, because it's so hard for us all to listen instead of thinking about what we want to say or prove ourselves right and prove somebody else wrong. But listening is going to be one of the hardest parts of communication.
And it's the most important part of communication, though, because you have to listen in order to be able to respond properly. But if you're listening to respond instead of listening to hear what's being said and then responding, then you really don't hear everything that's being said. Words can be really taken out of context when you're not actively listening.
Right.
So you have to listen in order to respond properly.
Right.
And sometimes when you don't hear it right, the question you ask is, hey, let me get it right, what you're saying, so I can clarify with myself what you're saying. So it's really important that you listen to what the other person is saying, at least so you can respond properly. And, and also ask the question to be sure that you heard what you heard.
Right.
So
and sometimes just even repeating what you think you heard. Like sometimes I'm saying one thing, and the way I say it, Joseph thinks is one thing, and sometimes he'll just say, well, let me tell you what I just heard you say. And then when he says what he heard me say, it's something totally different from what I was trying to say. So you have to be careful and make sure that you're listening to such a point and you clarify what's being said, so that you know that you're hearing what your partner is trying to say to you.
Right. So active listening is very important. Communicating in intimacy to get to intimacy is very important. And the type of communication you're doing, whether it's or the type of intimacy, whether it's spiritual, physical, emotional, recreational, or physical. Yeah. Mm-hmm. Whether it's either those 6 or 5, it's very important that you communicate through the whole process.
Right.
Because the only way you can get, to the root of anything is to make sure you communicate clearly
and respectfully. I think that's a big part of it too, is making sure that you are coming off the way you intend to come off. Because a lot of times when we talk about something and we're upset, we have to pay attention to our body language and our tone and how we're talking to the person we love, and make sure that we're always trying to communicate as respectfully and as lovingly as possible, even when it's a difficult conversation, or, you may be criticizing or, saying how you felt about something that hurt you, but you want to make sure that you're doing it respectfully and lovingly. And then you want to make sure that your partner that's communicating to you knows that you are listening and tuned in. Like, of course, you shouldn't be on your cell phone or watching a game while you're having such serious conversations and communicating. You should make sure you're taking that time to just be one-on-one with each other, so that you can truly communicate effectively and, experience all different forms of intimacy.
Right. And there's always times to communicate and times not to communicate. So in the heat of anything, it's probably not a good time to communicate. Especially if you just got a conversation with someone else outside of your spouse. Well, it wasn't a great conversation, but you want to have a conversation with your spouse. Probably not a good time. You probably need to clear whatever your mind is of whatever other conversation you had, and then have that conversation. Even like if let's say Mia's watching one of her shows she liked to watch, probably not a good time because she's like focused on that show or whatever, and probably not a good time to have a major conversation. Mm-hmm. And if if it's something that needs to be talked about, then you can really ask, is this a good time for us to talk? But you don't want to steer away from the conversation. You just want to pick a better time where a person can focus on what you're saying. So really important that you pick a great time. And sometimes you might need to go sit with yourself with the conversation and make sure that you're communicating the way you want to communicate what you want to be heard. Because sometimes you can go in the heat of a moment and not say exactly what needs to be said or how it needs to be said, so it can be taken in the way you need to be taken in. So really, sometimes you might need to sit down and really think about what you want to say before you go to your partner, spouse, mate.
And a lot of times I pray about it too, especially if it is a difficult conversation and I feel like I'm going to have to say something that could hurt his feelings or make him upset, instead of me just going and doing it. A lot of times I will pray and ask God to give me the wisdom and understanding to present this conversation in a loving and respectful way, so that it's going to be beneficial for us and not something to just push us farther apart. So, a lot of times if it's a difficult conversation, it's okay to pray about it and kind of, meditate over it and see the best way to talk about it. But of course, it needs to be during a good time when your spouse can give you their full attention. They're not on their cell phone, whether they're on their cell phone looking at Facebook or playing a game, their undivided attention. A lot of times, as long as, other people aren't around, especially if it's an intimate conversation that you should be having alone, making sure it's at a time when maybe the kids are in bed and y'all can be alone together in the room with the TV off and just really have some good conversation. And then just making a date of that, because we all do get so busy. So it's not wrong to make a date to have some time to communicate through the week, because a lot of times the time just gets away from us after we ripping and running for ourselves and for the kids and, our careers and everything else. So intentional communication, where you are effectively listening and you're communicating respectfully and lovingly, so that, and then you're listening respectfully and lovingly, and instead of listening to see what you don't agree with, listening to see what you actually agree with. What is it that your spouse is saying that you totally agree with? Focus in on that first. You know what I mean? Instead of just trying to listen so you can disagree and prove yourself right. Because it's not about being right. If you want to be in a healthy, happy marriage or relationship, it's about everybody feeling respected and loved. That part. So then, as far as communication, and when we're talking about communication with changes in our bodies, because we age and we mature and our bodies start to change. And that's one of the reasons we really got into this intimacy component, is because growing up and just the people we were around, it seemed like intimacy just kind of stops at a certain age, like that perimenopausal and menopausal age for women and that andropause for men. So usually in the 40s, 50s, 60s, people aren't talking as much about intimacy, and a lot of people are not having intimacy anymore. And we didn't want to be that couple. We wanted to be the couple to always enjoy intimacy with each other forever. And we understand that a big part of that is living a life of total wellness, so that we can stay healthy, so that our bodies continue to work and function, and we still have the desire and we balance our hormones, all those things. But I forgot what I was saying. What was I saying? Where was I going with that?
Remember? I don't know where you was going. You was going somewhere.
But we were saying, communicate about your body. Yeah, and your body changing. So for women, some of those changes is not as enjoyable as you age and mature, and your tissue starts to change. You may notice more dryness. You don't get aroused as easily. You're not lubricated as easily, and then it may be harder for you to reach that peak as you continue to age and the tissue changes. So that's why I make sure that my patients are treating their vaginal tissue before it becomes a problem. And then as we age.
Who do you communicate that with? That's not something you would communicate that with me.
Well, for me, you would communicate that with your doctor, but you can still let your husband know, like, it has nothing to do with you. Now it's become a little bit more uncomfortable when we're having intercourse and I don't feel like I enjoy it like I used to. Like, that's a real live conversation that you can actually have, and making it clear that it's not your partner's fault, but you've heard about this, that your body changes, and some of those changes are definitely happening.
No, something, but here's one thing I realized. A lot of people have not heard about that. A lot of people just think it happens.
Yeah.
And they don't communicate it.
Right. And then for men, you may notice that your erections don't stay as hard as they used to, or it's harder to have an erection or maintain an erection, and your sensitivity declines. So it's harder for you to reach your peak. And then to be on demand. So all of those things change with our bodies as we age and mature. So when they start to change, we first definitely should talk to our doctors about the changes in our body and try to make sure that we're doing everything we can to prevent those changes. And then also, making sure with our therapist and, we have that mental health specialist or person that we talk to. So if you're starting to notice some changes, you can kind of talk it out that way. And then, having a little bit more understanding so you can really have that conversation with your significant other. And sometimes it's another real difficult conversation where your partner may not notice that there's been a change. And for you, there is a change. And you got to figure out how to communicate that change and something that you may not like or whatever to your partner, which can be a difficult conversation. But again, it's the same thing. Go lovingly and respectfully, not during the time that the episode just happened, making sure it's at a time where y'all could be intimate and you have each other's undivided attention. But it's still okay to have those kinds of conversations and difficult conversations, and making sure that when you go, they understand that it's out of love and respect. But you still need to communicate when there is an issue or a concern with function, for whether it's your wife or whether it's your husband or significant other, that's the male or the female. If there are some changes, we should all be comfortable enough with our significant other to communicate those changes.
Most definitely communicate it with your physician.
Yes.
So we talked about communication and communicating about your physical and your wants and nots, and communicate with your physician.
And I think
I had a question for you.
Oh, okay.
So, in a women's case, because I would say the one thing I would really want to communicate as a man to my physician is if I'm having any sexual function issues. One of the things that's get misconstrued and aging is that certain things just happen. And we want to communicate with you that that's not true.
Mm-hmm.
Certain
may
things
happen,
do
it's
happen,
common, but it doesn't mean that's
but that
the
doesn't
end
mean
all.
there's nothing that can't be done about it.
Right.
So we want to dispel that myth that we're just getting older.
Right.
It is true. We are losing testosterone. We're losing hormones. Things are changing. We are getting less sensitive. We do go through menopause or andropause or those type of functions and things like that. But there are solutions to those natural things that happen.
Right.
So do not communicate that with your physician because somebody told you you're just getting old.
Mm-hmm.
That is a fact.
And if your physician writes it off, then you need to find another physician that you can talk to. You are getting older. But, because it's not okay for you. Because I have a lot of patients that come to me because they went to their doctors and they said, hey, I'm having these hot flashes and night sweats. My libido is down. I really don't want to have, intercourse with my husband anymore. It has nothing to do with him. And a lot of times those physicians say, well, that's just a part of getting older. Suck it up, honey. Or something like that. And that's not the appropriate response. The appropriate response is, well, let me check some hormone levels. Let me do an exam. Let me get a little bit more history from you so we can see exactly what's going on, rule out anything else. And then once we realize it's just the normal changes, it's hormonal imbalance, we can replace the hormones. If it's, the decreased blood flow in the vaginal tissue and you're starting to notice dryness and you're starting to notice that you get more urinary tract infections, or that you don't arouse as well, or that you don't get to a climax as well. Those are conversations, because there are things that we can do besides treating the vaginal tissue with topical medications. We can also do procedures, one called the O shot and one or the P shot. It's the O shot for women because we take the PRP and we replace it back into the area to increase vaginal and clitoral orgasms. And for men, we do the same thing. We take their platelet-rich plasma from their blood and we spin, replace it back into the area. That's going to increase the blood flow. That's going to help make for stronger, harder, longer erections. And it's going to increase the sensitivity for men. For women, it's also going to decrease leakage of urine with coughing, sneezing, jumping, laughing, and some some urgency and frequency kind of issues, and definitely decrease the risk of you getting urinary tract infection. So now we don't have to just say our intimacy is changing, we're getting well, and we don't have to say we got to take a pill, especially if we're not supposed to because of heart problems. Now we have some real procedures, the P shot and the O shot, as well as the O wave and the P wave, where we use the sound wave energy that helps with erections for men, helps with lubrication, sensitivity, and all of the other things for women. So now we not only have hormone balance, but we have intimacy procedures that can be done to make sure that we enjoy and experience everlasting intimacy, as long as we want to. And everlasting to me is just until the day before I die, is what I'm hoping for. And we do know that intimacy regularly is not only just healthy for your relationship, but for you personally. So women and men who continue to engage in intercourse as they age and mature are healthier than men and women who don't. It is the gift from God. It's healthy, and we can do the things that we need to do as far as total wellness, prevention, screening, and then any other procedures that we need to make sure that you and your significant other can enjoy intimacy forever, ever, 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 ever. Mm-hmm. So that's Ageless Intimacy with Dr. Mia and Joseph. Your assignment from me is to practice communicating more effectively with your spouse and making sure you're taking the time to talk about your feelings, talk about your day, talk about past experience, really putting some time and energy into the emotional intimacy. Because what we find is that when you invest a lot of time into emotional intimacy and spiritual intimacy and recreational intimacy and intellectual intimacy, it makes the physical intimacy that much better, because you're becoming so close to your partner, because real intimacy is going to make you guys really bond, and it's going to decrease isolation and increase oneness. And that's what we all want for our marriages and our relationships, is we want oneness. We don't want to separate. We want to be as one with God, the three. Mm-hmm. So what's your tip for today, Joseph? You usually give us a tip of the week.
Make sure you're communicating with your physician. If you got some issues, you need to tell them, because it could be something seriously wrong.
Right.
Or it could be something that can be easily, fixed. Mm-hmm. So, make sure you're communicating with your physician, because, there's not a I don't want to say it's not, everything can be repaired, but you may have something serious going on. When you don't have blood flow to your genital areas, that's blood flow through your body. Mm-hmm. So you could have a heart issue that you mm-hmm. are not addressing,
or high cholesterol.
High cholesterol. You have high blood pressure. You have diabetes. Mm-hmm. So make sure you're communicating with your physician, because if you communicate with your physician, then it comes back, everything's good, then you can be like, okay, well, I'm not getting a good erection, so let's address that. But you got to address everything else first.
Right. So, make sure your prostate is okay.
Just like you're communicating with your spouse, don't write anything off as just I'm aging. Don't do that. Make sure you communicate with your physician. Tell them everything. And that way you can, and if you're not, you can get what you need directly towards you. But if you're not getting the answers you need, change your physician.
That's right, because you should be heard by your physician, yes. And your questions should be answered by your physicians, right. And your concerns should be addressed by your physician. Now, your physician can't address every single concern that you have on one visit, but they may have to, schedule another visit and address as much as they can on that particular visit. But don't not address concerns. And if you need to do a follow-up appointment, do that follow-up appointment so you can communicate with your physician and make sure you have, great health, and you're doing the right preventions and screenings.
Yeah, communicate with your physician. That's the only thing I can say. Anything else? Because you can talk to your spouse about it, but your spouse is not a physician. If your spouse is not a physician,
right? But you want to still have conversations so that they know.
And you're talking to your spouse, and your spouse is not a gynecologist,
right? But and you may not be talking to them about that problem, but just letting them know that you've noticed some changes yourself, so that they don't think it's them, or that you're just not interested, or just that you don't want them anymore, when it's actually something going on with your body. But you should communicate that too, so that nobody thinks that it's them. Because a lot of times what men think is that, oh, you're just not attracted to me anymore. No, your hormones hormones messed up, like you're not attracted to anybody, not even yourself, at this point, because your hormones are so messed up. So communicate with your physician, but also communicate changes and when you're noticing differences with your significant other, so that y'all are all on the same page. All right, so I think that's it for us today. This was Ageless Intimacy with Dr. Mia and Joseph. Thank you for joining. I do have another event at the end of the month. We're going to be talking about vaginal health for women. It's going to be a webinar, and you should get some information about that very soon. So I hope you can join. Let your adolescent girls know to listen to it. Your younger adult women, you yourself, older women. This is for everybody that's a woman. And it's all about vaginal health and understanding your vaginal health and understanding your anatomy, especially in how it changes as you age and mature, all the way from adolescence through adulthood. So you want to be there for that. I can't even remember the date. It's like the last Tuesday of the month, I think January 30th. It'll be at 7 p.m. Central Standard Time. So I hope to see you there. It's free. Sign up for, register, and share. I hope y'all have a wonderful start to your week. Happy new week, and hope y'all have a wonderful Monday. And thanks for joining. We'll see you next time. Bye.
Bye.